Okay, so just tell me again what you'd like to learn about how hypnosis can help you with what. Your goal is to benefit from hypnosis for what type of problems?
For neuropathy
Mm-hmm.
and smoking.
Okay, so this is going to be a pre-talk to
Right.
tell you all about hypnosis and give you the opportunity to ask any questions that you have after I give you the pre-talk.
Okay.
So hold all your questions till after you listen to my pre-talk. Call this pre-talk Why Hypnosis is a Great Tool for Pain Management and Helping People to Change Harmful Habits like Smoking.
Right.
Okay, first of all, understand that no trust equals no therapy equals no treatment. Trust is a necessary ingredient for anything to work, whether it's hypnosis or counseling or surgery. Okay? Informed consent and an appropriate initial evaluation, forms the basis for trust. Now, we've already done that. We've already gotten to realize that I have the ability to offer you some help to make some changes that are positive for you. And we've already met a few times and I've evaluated you and determined that you're interested in my help. So it's an agreement that you want help and I'm here to help you. Now, the use of hypnosis as a therapy tool is based on the absence of fear in both you, the patient, and me, the therapist. If either one of us is afraid or doesn't trust, hypnosis is useless. And it's also based on collaboration between you and I. Okay? So the thing is that we all experience informal states of hypnosis every day, although we don't typically think we're in hypnosis. For example, we may daydream, right? You may get absorbed in reading or watching a movie or listening to music. And, it's possible to get reminded of some experience that you had or some state of mind or a mood state that you were in a long time ago just by remembering something from the past or hearing some music that you remember was associated with an old relationship that you had or a time in the past. That's age regression in hypnosis. It spontaneously takes you back to the past. We also experience hypnosis every day because we fall asleep, and just before you fall asleep, you're in a state like hypnosis, and just after you wake up, when you're lying there, you don't really want to move, you're feeling kind of relaxed, your mind is kind of waking up. That's a state of hypnosis, okay? Now, when a piece of music takes you back emotionally to a time in the past that you associate with that tune, you enter a state of spontaneous age regression, as I just mentioned, and that's hypnosis. And the same thing happens when you meet somebody who reminds you of someone from the past. Okay? Advertisers use hypnosis all the time with their catchy little sayings and their tunes, which keep jingling around in your head like suggestions. And every time that you remember it, or every time you see that same ad, you go into a state of hypnosis because it gets fixed in place in your unconscious. Some of it's annoying. Like I watch Fox and Friends early in the morning as I'm getting ready to go to work while I'm having my first cup of coffee, and I've been hypnotized to hear reverse mortgages every morning by that former senator. And that's sort of a state of hypnosis, but it's not something that I really wanted to listen to in the morning. It's almost like, where is he? When's he coming on? I'm going to hear about reverse mortgages. And I started to associate Fox and Friends with reverse mortgages. So now I'm watching CNN. It wasn't with my permission that they advertise that every morning, but that's a kind of a state of hypnosis. Now, in essence, as a psychological phenomenon, hypnosis is a state of being absorbed in an emotional experience. All right? And when you're absorbed in an emotional experience, your conscious mind, which is the critical factor, is bypassed. So you don't analyze stuff and evaluate stuff. And you trigger your unconscious beliefs and your memories and your thoughts And, that is what happens in hypnosis. Now, therapy can't happen without trust between you and me. So, hypnosis, which is something where, you get into this absorbed state and your critical mind is kind of taking a little bit of a break. That won't happen unless you're comfortable enough to let it happen. So it's all within your control. It can't happen unless you want it to happen, and nobody can be hypnotized unless they are willing. Okay? So that's very important for you to be sure that you understand. Now, hypnosis is a therapy tool, and it's nothing mysterious or occult. Many people associate it with that, like zap, you're under my spell, but it's not about that at all. That's the stuff of movies and of entertainment, which is not real. Okay? What it is it's a therapy tool that uses a natural psychological trait or capacity that every human being has to temporarily shut down your critical faculties and become absorbed in a daydream. And if you can daydream, you can be hypnotized. Because if you daydream, you hypnotize yourself without calling it hypnosis. Now, everyone that isn't mentally retarded can daydream, okay? And therefore everyone can be hypnotized. The question is whether or not hypnosis is the right treatment tool for you with your problem, with me, in a particular situation, like here in the pain center, okay? Now, not everybody is the right patient to use hypnosis with. I wouldn't use hypnosis with a lot of people who I don't feel comfortable with, okay? The process of being hypnotized is very simple, and here is how it goes. With your permission, I always ask permission before I do any kind of hypnosis. I will then guide you to utilize your own imagination to help you change your own experience in a manner that you and I agree upon. Okay? So I'm the hypnotherapist, you're the patient. I'm going to guide you to use your own abilities. All right? I'm going to help you to daydream and to imagine some things that you can really believe in, not anything that is so far-fetched that, would be ridiculous. Okay? That's, again, the stuff of stage entertainment. Now, when trust is present and therapy can take place, somebody like myself who uses hypnosis regularly can use a whole variety of techniques to help you enter this state of self-absorption, increased focus, and heightened suggestibility. But remember now, recognize you're only going to be suggestible and receptive to acceptable suggestions. Anything that, is not acceptable, you'll reject. Okay? Okay, you can't be made to do anything that's against your will or against your values with therapeutic hypnosis, okay? A person who's truly hypnotized doesn't try to make anything happen. In a real state of hypnosis, you're aware of everything that's going on, you're not asleep, and you allow your own experience to unfold so that you can actually be amazed by the power of your subconscious mind to change your experience. It does it all the time. And you can actually be amazed by what you can accomplish by just letting your mind do its thing, okay, with your essentially cooperation with the guide. I'm the guide if I do hypnosis with you. And this is why hypnosis is so useful for pain management, because pain comes on without your permission. It comes on involuntarily. And you don't have to try to be in pain. The feet hurt. And hypnosis has to happen with your permission, but it is also something that isn't based on trying hard. You can only go into hypnosis if you don't try. It's effortless, okay? And you can't be successful to try to make your pain go away. The harder you try, the more it hurts. And the harder you try to go into hypnosis, the less likely that it'll happen. So you have to just let it happen. And you can't make any mistakes. You just have to experience what you experience, and whatever you experience is just fine. Now, hypnosis, one thing hypnosis can do, and I'm going to cover several things for pain management, one thing hypnosis can do is it can lower your sensitivity to real physical pain. It can make you less sensitive to pain. It can make you suffer less, because pain without suffering hurts less. Okay? Now, there's a rule in psychology that states, it's a principle, that a strong emotion will always dominate a weak emotion. All right. So that's why if, let's say, you're feeling happy and then suddenly something frightens you, the fright wipes away the happiness. Okay. Now, that's an important principle. I'm going to go back to that in a minute. Another important principle is that when your imagination is pitted against your willpower, your imagination always wins. Willpower always loses. That's why diets fail. Because the imagination and how you see yourself is really what is more powerful than the willpower. That's why hypnosis is so good for weight loss and stopping smoking. Now, since therapeutic or clinical hypnosis, which is what I do here, is helping you to use your imagination in a controlled way, right? It's a very powerful tool for taming pain. Okay? Because pain hurts as bad as it does because it stimulates all kinds of negative feelings and beliefs and it makes you suffer. Well, pain minus suffering isn't as bad as pain alone. Or, I'm sorry, pain without suffering isn't as bad as pain with suffering, okay? So, chronic pain hurts both physically and emotionally. It's physically debilitating and emotionally draining. And when all reasonable medical interventions have been exhausted, why not enlist the power of your own subconscious mind to release yourself from suffering and at least experience a neutral state, if not a positive, pleasant state? That's what hypnosis can do for you. First, we move you into a neutral state and then into a pleasant and positive state. Just like when you're driving a car, you have to go through neutral to shift from reverse into drive or from drive into reverse. Okay? Now, hypnotic techniques can be used to promote pain relief directly and also indirectly by reducing the negative emotions associated with pain. Okay? Most people in a trusting, positive relationship with a physician or a healthcare provider or a therapist who uses hypnosis experience a lot of satisfaction when they recognize that they have learned to tap their own ability to change their own experience. That's what hypnosis can help you achieve. And hypnosis can actually help you master your own experience so you can master your pain symptoms. And you'll experience that when we start to do some hypnosis. And as I said earlier, it's not about zap, you're under my power, but rather about empowering you to get you to bring up your inner strength so you get greater control over your pain. Now, there are hundreds of techniques for inducing the state of hypnosis. And an experienced hypnosis provider, experienced hypnotherapist, will use the induction, we call them induction techniques. I'll use the induction technique that I think is best matched or best suited to you. Now, it may be necessary to try several different induction techniques over several sessions to find just the right one, okay? Then, once the right approach is discovered, I'll repeat it several times and I'll help you to learn to boil it down into a simplified form so you can practice your own self-hypnosis on your own so you can repeat the relief and the positive experiences that you'll have here in the office. Okay. Does that make sense?
Yeah.
All right. Now, through the use of direct suggestions and hypnosis, I'm going to help you to associate certain everyday cues in your life with comfort and pain relief and other positive experiences. And that's called the use of post-hypnotic suggestion. In other words, suggestions I'll give you while you're in hypnosis for the suggestions to actually work without your conscious awareness, but with your permission when you're going about your daily chores. All right? Again, you can't be hypnotized against your will because all hypnosis is guided self-hypnosis. And you'll only accept what I say that's acceptable, and anything that I say that's not acceptable or distasteful or doesn't fit within your needs at the moment, you can reject it or not even hear it. Only people that are antisocial will say they were hypnotized to do X, Y, or Z. Nobody can really be made to do anything against their will or their value system, okay? Therapeutic hypnosis is not about that. It's about trust, as I mentioned. Well, I'm always going to go back to that idea of trust and helping. And you never, as an ethical hypnotherapist, I would never use hypnosis with anybody that I wouldn't do any kind of therapy with in the first place. Okay? Now, hypnosis is not the same thing as sleep. A lot of people associate it with going under. You don't have to worry about that because you won't be asleep, so you'll wake up because you're not going to be asleep in the first place. So nobody can be in a state of hypnosis and not be able to wake up because you're not asleep in the first place. That's a myth, all right? When you're in hypnosis, both parts of your mind, your conscious mind and your unconscious mind, will protect you from unwittingly accepting suggestions that are not tasteful to you. All right? You'll simply ignore them, reject them, or not hear them. Okay? You only accept suggestions that are acceptable. And it can be no other way in a therapeutic setting. Okay? Now, you can be hypnotized. Joe Smith can be hypnotized. Bob Jones can be hypnotized, as long as they are willing, as long as they want to cooperate, as long as they have a moderate degree of intelligence, as long as they have the ability to daydream, as long as they can pay attention, as long as they're not afraid of the person that they're going to work with using hypnosis, as long as they trust. And one more thing, if somebody has serious psychiatric problems, forget about it. It's probably not going to work, because even if they have the natural ability to daydream, they'll get distracted by their psychiatric problems. Okay? So hypnosis is going to help you manage your pain, and we'll have to deal with one problem at a time. So we'll decide after this pre-talk what we're going to address first, smoking or pain. Okay? In terms of pain management, okay, because that's what this pre-talk's really about, there's two paths to helping you manage your pain with hypnosis. In path one, I can help you enter a state of pleasant, relaxing hypnosis and focus, and then I can administer to you direct suggestions for helping you to transform your pain sensations into greater comfort, into more comfortable sensations, using your imagination, okay, and your body and your mind. So I can do that. I can give you direct suggestions for improving your motivation to improve your functioning in everyday life. I can give you direct suggestions to improve your stress and frustration tolerance, direct suggestions to replace negative thinking with realistic positive thinking. I can give you direct suggestions to tap into your sense of faith and gratitude, direct suggestions to teach you how to distract yourself from pain so you can filter the hurt out of pain. And that's pretty much the direct approach. Now, the second major way of using hypnosis is through what's called hypnotherapy. Now, hypnotherapy in a nutshell is going to take place over a number of sessions, and what it involves is exploring the emotional roots of your persistent pain, okay? And what it involves is the discovery, through the use of certain techniques, of emotional factors that have been associated with the continuation of pain and suffering since it originated. But you see, you may have pain, but you may be suffering from more pain than you need based on your physical pathology in your feet or wherever else you have pain. In conducting hypnotherapy and this exploratory analysis, it's typical for most patients to experience spontaneous as well as directed regressions back to memories from the past that are often unanticipated, that have an emotional connection with your persistent pain, okay? And sometimes those memories are not pleasant. So it's important that, number one, I, as the therapist, believe that I know you well enough to be able to help you to deal with those memories should they spontaneously arise. And number two, that you and I have the understanding, if we're going to work in that way, that it might be actually therapeutic for us to go there so that we can find the emotional roots and emotional causes of persistent pain that is unnecessarily severe, so that you can find out what those causes are and then release them, as well as the bound up negative emotions that you've been holding on to that are making your pain worse. And by reliving those past experiences that may have been hurtful and that you may have forgotten, okay, and releasing those emotions, okay, what we can accomplish, and this is the key, is I can help you through a technique called reframing to change your self-image, to change the way you think about yourself today in relationship to what you've been through in the past, okay, and in relationship to your pain, and in relationship to all the things that have happened in your life that you may not be happy about, okay? So the goal of hypnosis and hypnotherapy for pain management is to help you to live with less pain and more comfort, all right? An experienced hypnotherapist can actually help you change your self-image and your memories of the past so that you think about your present, your past, and your future in a more positive, functional way so that you can live a more functional life and be more comfortable and have less pain, okay? And not suffer so much. Because the principle here is that some pain may be mandatory, but excessive pain is unnecessary, all right? And I just want you to know, in concluding this pre-talk, that hypnosis is the oldest non-drug, low-risk remedy for pain relief in the history of humanity. It was used by humankind going as far back as the ancient Egyptians. It's used all over the world. It goes by different names, such as, for example, Native American healing, faith healing, prayer, spirit releasement, meditation, prayer, relaxation therapies, shamanism, energy healing, all kinds of things of that nature. Those are all positive sorts of things. I'm not going to mention the negative stuff, okay? Now, you got to know that therapeutic or clinical hypnosis is entirely different from stage hypnosis, which is for entertainment purposes only, okay? Therapeutic hypnosis is for healing and for therapy, and stage hypnosis for fun and entertainment. But there is one thing that stage hypnosis and what we do here, which is called therapeutic hypnosis, have in common, and that is that you got to be willing. Nobody volunteers to go on stage and act like Elvis Presley or Madonna unless they want to have a lot of fun cutting up, okay? So that basically is the extent of this hypnosis pre-talk. And now that you've heard all of these important facts, I'm going to give you the opportunity, I'm going to turn the tape off and give you the opportunity to ask me any questions that you might have, okay? So let me turn the tape off.